Being here. It's great to be at Harlem Hospital. Of course, this is an institution with a legacy, a history, a noble and important cause, not just for Harlem, but for the entire city, and I dare to say the world. And so thank you, all of you that are folks that work here. Thank you for what you do. And the time and effort that you put in making sure that our community is healthy. Right? And it is so important that we continue to work. We know firsthand, Mr. Roddy's here, the fentanyl crisis is devastating the country, really. And unfortunately, Harlem has not escaped that reality. And we must do better as a city, as a state, in addressing the dire needs of folks, New Yorkers, men and women that are addicted to fentanyl and the havoc that it causes in their families, in their own personal lives, and of course in the community. And for that reason, I have been working with a group of local residents, and in fact, we brought the governor to see for herself, to witness for herself, the impact that the oversaturation of programs in a particular area, the impact that it has in the community, and how we can best address that. Understanding that it is a health crisis first and foremost, understanding that these folks need help and treatment, but understanding also that you cannot just load up a community with 13 programs in a 5-block, 10-block radius and expect that it's not going to have a dramatic impact on it. So we want to make sure that the services go to where people live, to their own neighborhoods and where they feel comfortable. And so we have a lot to do there, and I hope that Harlem Hospital continues to be a partner with us in that endeavor. So that's the first thing. But what I came here to talk to you about is Medicaid and Medicare. Those two important programs that are so critical to our communities. In my district, in the 13th Congressional District, in your district, we have close to 500,000 folks that are Medicaid recipients. And you know that very well right here in Harlem Hospital, because this is where they come. In fact, they may not go to other hospitals and they come directly here. And this is also a trauma center, a prestigious trauma center at that, that will also deal with complicated situations, medical situations that for people that are in the Medicaid program and in the Medicare program. So 130,000 people are in Medicare. So together, there's about 630,000 people out of the 780,000 people that I represent that are either Medicaid or Medicare recipients, right? In addition to that, you have close to 300,000 people that receive SNAP benefits, food stamps, including children. And you have also 188,000 folks that are on Social Security. So Medicaid, Medicare, food stamps, Social Security, that's the safety net. You know, Adam Clayton Powell Jr. was the architect of the social service safety net. So in essence, those programs have a genesis, a connection, a DNA directly connected to Harlem. And so this safety net cannot be fractured, because if you do that, then it impacts families in disproportionate ways. And it prevents family from pushing their kids upward, right? Because when you have Medicaid or Medicare, you have that insurance, the public insurance. It's not necessarily a financial burden on you if you get sick. But if you don't have it, it can crush you financially in weeks and prevent you from moving your children forward, your grandchildren. So this is beyond, I think, just the healthcare paradigm. It's something that impacts economically our communities and our families. And Harlem Hospital 85% of all people admitted and 71% of all patients provided care for are covered by Medicaid and Medicare. So this is a hospital that has an umbilical cord, a direct connection to these two programs that if impacted, it could devastate the finances here. So that's why I'm here today, to enlist you in the efforts that we must put forward to prevent these cuts from happening. And already, $800 billion were projected and cut by the Republican budget, and we must, at future junctures, either through the process that's called reconciliation or the debt ceiling debate, we must intervene as Democrats and get some of that money back, fight to get some of that money back and prevent from additional cuts being implemented. It will be very difficult for the current administration to hand over $1 trillion in tax breaks to the rich buddies unless they dismantle and cut Medicaid. And we know that Medicaid was handsomely benefited by Obamacare. It infused extra dollars into hospitals like this hospital so that we can take care of our patients in a dignified and professional way. So many people say, what are you doing, Congressman? Well, this is what we're doing. I want you to be clear what our approach is, because we gotta fight hard, but we also have to fight smart. If you fight hard and you don't fight smart, you lose the battle. If you fight smart, but you stay home sleeping, you lose the battle. You gotta fight hard and fight smart, right? And so the first pathway is legal, and there's over 120 cases that are being litigated right now in the courts, right? Some of which I'm not directly involved in, addressing the executive orders and the actions of this new administration. So we must use the courtroom, and so far the courtroom has been somewhat good, but also unkind to us, but we gotta exhaust that avenue, the courtroom. When everything else goes bad and wrong, you always have the courts to go to. Brown versus the Board of Education, reverse Plessy versus Ferguson. That was a landmark case that shifted things in the right direction for us to continue to push the fight for civil rights. So this is an avenue, a platform where we must go to, and we're doing that. Now, the current administration is intimidating the law firms. The big law firms that traditionally provide pro bono work for these important cases is white shoe, well-heeled law firms are being extorted. To put it directly, they're being pushed into not doing anything, and then they're being asked for extra money. One law firm had to give up $100 million in pro bono work for their causes. So this is the state of affairs in America, and we must fight back. And so that's the first pathway. The second one is legislative and budgetary. And of course, we have to, at those junctures that are coming up in 2 to 3 weeks, we must exert our power, although we're in the minority. But sometimes when you're in the minority, you get a little extra punch in your fight. I always go for the underdog, because I know the underdog has got a chip on their shoulders. They got something going on for them that, they're in the ring. They may be the underdog, but they're in the ring, right? So I think that we can do stuff. And we gotta strategize internally to do that. And then finally, the third lane is you, us, the public. Now, Abraham Lincoln said right in the middle of the Civil War, public sentiment is everything. Imagine that, right in the middle of the bloodiest war, the most divisive war, that split the country, north, south. Abraham Lincoln said, public sentiment is everything. And you can dominate public sentiment when you tell your story. Harlem Hospital could shape the public sentiment of this nation by telling your story of what you do here on a daily basis and making sure that America understands that the Medicaid and Medicare program cannot be dismantled. And so this is where we are. These are the three roads that we're taking: legal, legislative, budgetary, and then organizing in the community. So I started this morning at New York Presbyterian Hospital with about a couple of hundred seniors. We're here now. We'll finish this afternoon at Montefiore Hospital in the Bronx part of the district, all the way up in Canada up there. I may add that
long day today.
I may add that Congressman Rangel, one time we were talking about redistricting, and they were telling him about the configurations of a new district, and then they said to him, you know, it's possible that your district could now go up the west side and then connect with Mount Vernon and White Plains Road. He goes, I ain't going up to Canada. That conversation ended there immediately. Anyway, but I want to welcome our panelists and our host here that are tremendous, and they have a tremendous grasp on the issue from different perspectives. I think I jumped the line because I had to get Lloyd Williams to give welcoming remarks, but when a politician sees a mic, it's just, they gotta fight me off with this. But Lloyd knows how to throw an elbow, so I'll introduce Lloyd Williams from the Harlem Chamber of Commerce, the Greater Harlem Chamber of Commerce.
First of all, good afternoon, everyone. Thank you so much for coming out. Please forgive me for being the only male on the dais without a tie and everything else. Unfortunately, or fortunately, I've been running around with my grandson this morning because of what's happening with schools, and this was more appropriate for my grandson. My love of life, his name is Lennox Ali Williams, and it's appropriate that I'm here by Lenox Avenue as I'm addressing that. Let me just say this and not be long-winded. These are serious times. And as a result, I thank you all so much for taking time out of your busy schedule to join with us. We are in perilous times. I happen to be thought to be an historian. And the time that we're in today, we have not had a time like this since the Reconstruction period, where the whole nation, in fact, the whole world, is in turmoil. But we need to understand that, the congressman, who happens to be one of my great friends, he reminded me about Adam Clayton Powell Jr. I hope you will remember this statement from Powell. And he was addressing all of the things that people were saying at that time about what could not be done and why it won't be done and why it shouldn't be done and all of that. And he said something that keeps bouncing in my head. And he said, it's what's in your hand, okay? It's what's in your hand. And we oftentimes focus on what's not in our hand. We focus on what others control and what others say. But as the congressman will tell you, all politics is local. So those of us who don't participate in the community boards, do not participate in the school boards, do not participate in our block associations, do not participate in our unions. We want to have a whole lot to say about what's happening at 1600 Pennsylvania Avenue. You know what they should do? How come they haven't done it? This is what, but it's what's in our hand. And if we play effectively what's in our hand. When we listen to that which is happening with migrants, I'm asking everyone to just really answer the question, don't go too far or back, etc. But as I was sitting next to Mr. John and Mr. Georges and to our congressman, something occurred to me. So help me on this. How many people in this audience, family, come from another country? Please raise your hand. Okay? I just want you to see. I just want you to see when they're talking about migrants, they're talking about you. Okay? You need to understand what that is about. And the congressman was kind in referencing that they will take money from Medicaid and Social Security and all different types of service budgets that respect and relate to our needs. And they will comfortably give it to the billionaires. Okay? I won't go too far with this, but I want you to kind of think about this. So you saw what happened with the tariffs, and you saw what happened with the stock market, up and down and all of that. One of the things that will come out in time, not this year, maybe, but what's going to come out is the millions of dollars, billions of dollars of profit that went into the Trump supporters because they knew what was going to happen with the stock market. So if you know the night before, if you know 2 hours before, if you know 1 hour before what Trump is going to say, all you do is go and hedge your bets. They made billions of dollars as we suffer. So let's talk about Harlem Hospital. The reason I was asking about where you come from, when you think of Harlem Hospital, whenever I think of Harlem Hospital, I think of Tito Puente. Because Tito Puente was born in Harlem Hospital. I'm just trying to connect the dots for y'all. Okay? So you're from Barbados, and you're from North Carolina, and you're from New Orleans, and you're from Jamaica, and you're from the Dominican Republic, etc. And at the end of the day, as my congressman referenced to me years ago, all it is where did your boat land? That's all this is. Okay? Where did your boat land? And what was the colonial master in that area where your boat landed? And therefore that dictates your language and what you speak. But let's just bring it back home. And that is, all politics is local. Those of us who thought it was not important, it didn't make any difference, nothing would change, and all of them are bums. So it didn't matter if Kamala Harris won, okay? But now look at what's happening to your egg prices. That's simple, okay? Look at what's happening. Just put this into context. The richest man in the world has a group of people going throughout the feds and firing hundreds of thousands of people. But in closing on that comment, so we got a problem with the Hispanics. from Mexico and from Colombia and from Africa and from Dominican Republic. We have problems with them coming over here. Okay? But how many of you paid attention to what Trump is doing now with the rich white South Africans? Okay? Not only has he opened a fast track to citizenship, he actually has money to give them to get them started in what they want to do. So what does that have to do with why we're here? Okay? It has to do with the fact that they are talking about us. And it's not color. We get caught up in that trap. It's white versus black, it's Hispanic versus African American and all. That's a trap. Okay? What it is good versus evil. It's right versus wrong. And so all I say to you is this. How do we fight this off? Well, you establish a communication with the most important person in the room. I want you to, everybody, focus on who is the most important person in this room. And that's who you establish your relationship with. Who is the most important person? Well, it's the person in front of you. It's the person in back of you. It's the person beside you. Left or right, they are the most important persons in the room. And many of you don't really know that the people in this room are your cousins. You don't know that. When do we find it out? We find it out at funerals and we find it out at weddings. Okay? So I thank our congressman. There have been a number of people who said to me, well, why are you dealing with him? And he is Hispanic and he is Dominican. No, he's my brother. And he's my friend. And I love him. We don't always have to agree, politically or whatever. We don't have to agree. But when you walk out the door, you do me one favor. You walk out this door having introduced yourself to a minimum of 2 persons that you did not know when you walked in the door. Okay? So you guys gonna do that? Let me see y'all gonna do it. Let me see your hands. Come on now, come on. Don't raise your hand and not do it now, okay? And gentlemen, you don't have to pick out the prettiest lady. I understand choice. Harlem Hospital Center. Harlem Hospital has meant so much to this nation. This is the hospital that saved Dr. Martin Luther King Jr. when he was a moment away from dying, having been stabbed on 125th Street at book signing. So let me now introduce you to that person who has the gift from God because God has brought him here to head up Harlem Hospital at this time. The distinguished Georges LeConte, the CEO of Harlem Hospital. And don't forget, you're gonna meet somebody before you leave.
First and foremost, good afternoon, everyone. And I want to thank the congressman for making this happen. This truly is an important event. You know, there's a saying, health is wealth. If you don't have your health, what else matters? Right? What else matters? Medicare and Medicaid cuts, they're cutting on your health. That's what it comes down to. It's really cutting on your health. Let me give you some statistic. And I'm going to give you a little bit of statistics about Health and Hospital itself, which is the largest municipal health care system in the United States. Okay? We've got 11 acute care hospitals, 5 post-acute care hospitals, 30 community health services, home care services, correctional health, and health plans, such as MetroPlus. All of that is for people who cannot afford your general health care. So a lot of that comes through Medicare and Medicaid. And in some instances also, self-pay. Now, what does that mean by self-pay? Now, you know, my CFO would be, it's no pay. What we do here is we provide care for everyone. No exceptions. No exception. You have insurance, you don't have insurance, you can pay, you can't pay. We provide that care to you. But we can't do that without the funding necessary. And if you cut those fundings, that means that we can't provide the care that we need to. Not just we want to, but we need to provide to our community. It is vital that we do that. So I'm just going to give you a little example of what we provide here, okay? Last year in Harlem itself, we saw over 870 people rely on our care here at Harlem, okay? 360,000 visits we had. Over 600 babies delivered. Over 99,000 emergency department visits. Over 282,000 outpatient visits. That's our clinics. That's our dental clinic. Now, some people don't think about dental clinic as one of the key aspects. Has anybody ever had a dental pain? You ever had toothache? Oh yeah, it makes you crazy. It certainly does. Now, we had over 10,000 inpatient visits. Over 4,300 ambulatory care surgeries. All of that comes through funding. You have to remember, we provide care for everyone in this community. We're a trauma center. We care for all those traumas that takes place. Whether it's a motor vehicle accident, firearm injury, falls, stabs. We do all of that. And we need to continue to provide that for our community here. One of the things I want to do also is get my partner to come up here from Metropolitan Hospital, because we are a partnership. So I'll ask Julie and John, the CEO of Metropolitan Hospital, to come up and say a couple of words also, because it's important for us to understand.
Good afternoon, everyone. George, I would like to thank you for introducing me and for co-hosting this event. And I would like to thank our Congressman Espaillat for inviting me here today to represent our community. Thank you. And most importantly, I want to thank you, Congressman, for always being a champion for New York City health and hospital system. We are so grateful. Thank you.
Yeah.
Metropolitan is the primary healthcare provider in East Harlem. And we are proud to serve El Barrio and people from the 5 boroughs of New York City. El Barrio is the poorest district on the Upper East Side, and our community struggles with ongoing health problems like diabetes, high blood pressure, and obesity. We are committed to doing the work to make our community healthier. Whether you have insurance or not, no one gets turned away from Metropolitan, Harlem, or any of the other H&E's facilities. The reality is that nearly 75% of our inpatient discharges, and that's Metropolitan in particular, are covered by Medicaid. That revenue also supports the cost of providing care to our patients who have no health insurance at all. And I'd like to give you some numbers in regards to the people that we serve. So at Metropolitan, we serve over 82,000 New Yorkers annually across over 500,000 visits. We have over 1,100 babies delivered in Metropolitan, over 65,000 emergency department visits in a very small emergency department. Over 435,000 outpatient visits. We had 8,300 inpatient discharges, and we provided care for over 6,600 ambulatory surgery procedures. That's a lot. And as I mentioned before, we had 75% of our discharges that were covered by Medicaid. So looking at those numbers, obviously cutting Medicaid would lead to more New Yorkers seeking care in our emergency rooms. All of this would come at the time when our emergency rooms are over capacity. Our community and its healthcare will be devastated, obviously, with any cuts to Medicaid or Medicare. As New Yorkers, we need to work with our congressman to prevent site-neutral Medicare cuts, and we need to protect Medicaid. We want the federal government to reconsider these cuts and keep us whole. We work hard with very little, both of our institutions, but I would say that we provide high quality care that is second to none. High quality care that is better than some of our wealthier facilities. And so our system needs to be protected, and we need to ensure that cuts are not made to our limited resources. I would like to end by saying Medicaid is critical to keeping our patients and our hospitals healthy. Thank you.
Thank you both. Between Metropolitan and Harlem, this is the two safety net hospitals that really, I think, perhaps in the nation are serving the neediest communities. Any place, certainly in the city and state, if not the nation. And so I look forward to working with you. I know you have an issue with the emergency room that has great challenges, and I want to be helpful, and I want to also be helpful with capital projects here at Harlem Hospital. We can work together to address them. And so now let's introduce the Executive Director of the Harlem Bureau of Neighborhood Health for New York City and the Health Department, Carmita Padilla. Welcome.
Good morning, good afternoon, good evening, where are we? Thank you, Congressman, for the intro, but actually for the invite here, for the partnership with H&H. That's why we're here. We need to do this work together. We need to fight this work together, so I'm really happy that we're part of this. And just sitting here, I've been reflecting on the work that we're doing. I've been working with H&H for quite some time in many locations, but just recently the letter that we even posted together to say that we are here for everybody. Doesn't matter who you are, doesn't matter where you're coming from, doesn't matter if you can pay or not, nothing matters. We are here for everybody, and that's how we as the Department of Health, H&H, Congressman, we all have to be here together with all of you, so I really am happy to be here. So the Harlem Bureau of Neighborhood Health is part of Department of Health. It's our Center for Health Equity is the division, so we are here with the community. We have 3 bureaus that are on the ground working with the community. Myself in East and Central Harlem, we have one for South Bronx and another one in North and Central Brooklyn. If you know those areas, those are the areas that have always been disinvested. And why we are as a Department of Health in those areas is because we want to invest in them, and we are part of the community. We are 3 very unique parts of the Department of Health where we are on the ground with the community, part of the community, following the community and what they need, and that's what we're here for. So as part of that, we're in that, and in those areas are the ones that need the help, right? There are economic inequalities there, health disparities, all those reasons, and now we talk about Medicaid and so many other issues that are coming down from the federal government that are not going to help in those areas. We're there to help to try to get out of the inequity. How do we grow and expand on that? And part of that is the safety net that the Congressman was speaking about. Medicaid is part of that safety net. Another part of the safety net is us being in the community. We have an action center in all these 3 different communities that I spoke about, but in East and Central Harlem, we're on 115th between Lex and 3rd, and the idea is to be there, to be a location that we can be partners, bring in all the partners from the community to work together, to address the situations that the community members tell us that they need. And for example, we're there to enroll people in Medicaid or NYC Cares as part of H&H, whatever health insurance they need so they can get health care. We have, there's a huge issue about access to food. How about food vouchers. What else can we test? How do we bring the resources that the community needs? There's an asthma issue. We know that's a big issue, right? The chronic disease, asthma, diabetes, hypertension. What are the services we can do now? We've got an asthma program so we can help the kids that have asthma. We have a program where we have community health workers in NY-13 developments to help them manage their chronic disease. The community health workers are there to support the individuals in managing the health care that they're getting from these H&H systems, right? So that's what we're there, that's what we're doing, and then this happens. So we are in places that are disinvested, as I said. There's 28% of East Harlem is on Medicaid, and about 23% of Central Harlem is on Medicaid. And you have more statistics that you share that I don't even have right now, right? That's the individuals that need our help. You take that away, they're not going to be able to come to the hospital. They're not going to get their primary care visits. They're not going to get their medication. They're not going to be able to get the transportation they need to get there. We're helping them to manage these chronic diseases to help better, and then these cuts come in, and they're not going to be able to get the help they need. So the disinvestment is going to be worse. The inequalities are going to get worse again. The health disparities are going to get worse. As we were building, and we continue to build together, that's what's going to start happening if this occurs. So we can't let that happen, right? We need to be able to be there so that everybody has access to the health care that they need. You actually spoke about fentanyl too in the very beginning. That's another issue, right? Substance use, mental health, huge issue in our community. And we don't have enough resources yet. We do Medicaid cuts, we're gonna have even less resources. We're gonna eliminate any few resources we have. So how do we keep this funding that we keep so that every individual has access to what they need and the health care they need? And that's what we need to do. As a Department of Health, I'm here to represent that, I'm here to fight and be a partner to everything. And I'd like to also say, we are fighting, we are resisting. The one thing about being the Department of Health that I am so proud of to be right now in New York City is these comments are coming down, these executive orders are coming down. We're not giving in, we're resisting, we're fighting. None of that has changed us in any way. So I will say every week, every Monday, or if it's something that happens during the week, if an executive order gets down, the first message we get from our Commissioner of Health is, yep, executive came down, we're not doing anything, don't do anything, there's no change, we're not stopping, because that is how we're gonna make this work. So we are resisting is the fight, and we're gonna continue doing that, and we can do that because we're in New York City, because of us. So we're so happy to do that. So we're gonna keep on resisting for you and with you, and that's what we're gonna do. So thank you for having me here.
Thank you. And let me just also address another issue, because I think there's been a massive distortion of what a sanctuary city is, right? Most people think now that a sanctuary city may be a city that harbors like violent criminals, right? No, a sanctuary city is like a hospital like this that the mom will bring her kid to the doctor, to the pediatrics department without the fear that the nurse is gonna call the Department of Homeland Security, right? That's what a sanctuary city is. That a parent will take their children to school without the fear that the principal is going to call the authorities on them because they don't have the status, or that a woman could go to a local precinct and report a domestic violence situation without the fear that she's going to be arrested when she goes there. That's what a sanctuary city is. It's a safety net for those that need the help. And so it's important that we understand that, so we don't weaponize the whole immigration debate in a way that it pits us against each other, right? And so we must do better, and we got to work together. I already laid it out what the 3 avenues are, and I want to open up to questions, because I think